Hey folks, it's Dr. Michael Jones, president of the Medical Exercise Training Institute. We're back here for another installment of Medical Exercise Training, the new modality. Now, I know some of you watching are fitness professionals, maybe healthcare professionals, and you're thinking about making this transition to medical exercise training. You see there's a need. You've got a few clients that have medical conditions and you've trained them and you aren't quite comfortable in managing them at this point because of their conditions. And folks, that's what we saw back 26 years ago. We realize these clients are coming to you. We realize they've been discharged from physical therapy, chiropractic care, and now you've got to manage them and you're not sure what to do. You're not equipped for it. You want to go on Google and look up things on Google. Maybe you get a few physical therapy or orthopedic textbooks and you're kind of thumbing through those and reading them and you're not 100% clear. Well, back 26 years ago, we put together the Medical Exercise Specialist Workshop and Certification to be that education you needed to successfully, effectively, and competently bridge the gap between healthcare and fitness. So with that, let me tell you a little bit more about medical exercise training, the new modality. Now, there's a new healthcare professional, okay? And that new healthcare professional is the medical exercise specialist. Medical exercise training services are provided by medical exercise specialists, the MES, and we started this back more than 25 years ago. We did the first course back in 1994. Now, there's another organization out there that will tell you they started it and whatever, and they'll tell you their start date was, 2005? But we know for sure that the first certifications they sent out that said medical exercise specialists were in August or sometime in 2015. We've been doing this now, folks, for 26 years. We have medical exercise specialists on 6 continents, and they built very successful practices. So the medical exercise specialist is, I'll say, not or no longer a personal trainer. They've evolved beyond that. The course we offer specifically trains you in to make that transition away from being a fitness professional to a medical exercise professional. It requires a different thought process, a different mindset, where you now understand the related anatomy and pathology of the client's condition, where now, based on that related anatomy and pathology, and then the application of the assessment procedures and the exercise, you now make professional judgments. It's no longer in the dark wondering, what do I do? It's now more specifics, and we go over specific protocols in the course. With that, each MES is trained in management of medical conditions utilizing a protocol-based approach, so nothing falls through the cracks. And with that, these medical exercise protocols are the basis of every aspect of medical exercise training, whether you're doing it in the water, you're doing it with maybe flexibility or cardiovascular training or stabilization exercise. Maybe you're a Pilates instructor. It works across the board. There are certain fundamental concepts in the management of medical conditions that don't change. Only the setting. The Pilates studio compared to out on a practice field, compared to working in a facility where you're working in a post-rehab program, maybe in a physical therapy clinic. Once you understand the basic sciences of medical exercise training, folks, no one can take that away from you. And it makes it a lot easier to manage clients, and no longer are you afraid of hurting someone. No longer are you afraid of communicating with a doctor, therapist, or chiropractor because you aren't really sure. We're going to train you in anatomy and pathology, how to communicate with doctors, with medical terminology, writing progress reports, things of that nature. You need all of these things to be able to effectively manage clients, but more importantly, to communicate with doctors, therapists, and chiropractors, and to manage your own practice. So with that, the role of the medical exercise specialist is simple: to deliver safe and effective exercise for medical conditions. Number 2, effectively communicate with medical professionals. We'll teach you how to do that. Provide recommendations on exercise for medical conditions. Folks, how many doctors do you think right now have someone sitting in their office saying, "Doc, should I buy a treadmill or buy an elliptical?" Doctor doesn't know. And don't say the doctor should know, because he or she shouldn't. They're trained to manage diseases. That's what they're trained to do. They're trained to read x-rays, read CAT scans, give medications, do surgery, do the overall medical management. You're trained to be the exercise person. And with that, the medical exercise specialist helps you do that. So don't say they need to know how to do it, because if they did know how to do it, there'd be no need for you. But there is a need for you to get additional training and knowledge so that now you can bridge that gap between healthcare and fitness. And instead of wondering around where your next client is going to come from, now you say, all I got to do, I've developed relationships with medical professionals. They're referring clients on a regular basis. Because folks, I'll tell you, these chronic conditions aren't going anyplace. Now, with that, the medical exercise specialist has to document functional outcomes. So instead of just simply saying, hey, you know what? The client feels better, they have more energy. Now it becomes, hey, we actually have measurable outcome factors that we can look at and say the client is getting better. Folks, that's a great feeling when you can report to the doctor or therapist the client's blood pressure has gone down or their A1C has gone down. Now, you're not going to be the one getting that information. You're getting that from the doctor's office, which means the client is going to sign a medical release form, which we'll train you in the MES or PRCS program. But with that now, the doctor is going to say, hey, this person's A1C value has gone down. In our facility, we have a gentleman who suffered a stroke a few years ago. He's coming in for our post-stroke exercise program, and his endocrinologist is so enamored with our program because his A1C values have come down to within normal limits now with the ongoing exercise he's doing. That now means that endocrinologist is going to refer to us on a regular basis. That's what you want, folks. You need to look at those functional outcome measures, but most importantly, get comfortable with communicating and documenting. And then lastly, you've got to provide some aspect of wellness and lifestyle education for these clients. Yes, they saw the doctor. Yes, the doctor told the client to do A, B, and C. But folks, I can tell you, I've seen this a number of times with patients I've seen as a physical therapist. Patient walks out the door and you told them to turn right when they walked out the door and they turn left. They've forgotten everything when they walked out of the door. So this is where you, the medical exercise professional, come in to reinforce the lifestyle education and wellness guidelines the doctor has given the client. So you can see your needs are exponential. It's not just simply the exercise. You become a vitally important component in this whole healthcare management process. And folks, right now, with COVID and then post-COVID and the number of people that no longer are being insured or insurance carriers are cutting back, you become vitally important, but you have to have the proper education. So if you would go over to medicalexercisetraininginstitute.com to get more information on our PRCS, MES, or Medical Exercise Program Director certifications. Folks, I'll tell you this. When we started this years ago, we wanted to make sure the programs were in-depth and thorough. And folks, I can tell you, they will give you the competence, which will give you the confidence to go out there and manage a wide range of conditions and talk effectively with doctors, therapists, and chiropractors. We're not expecting you to know how to read MRIs or how to set broken bones or provide physical therapy services or joint mobilization or prescribe medications. We're training you to provide safe and effective exercise and to communicate with doctors, therapists, and chiropractors. If you're a fitness professional, you already know how to do exercise. We're going to now show you how to apply exercise to these medical conditions. So please check us out, and also down below, make sure you subscribe so you can get the next installment on this video series. And I wish you all the best in building your medical exercise training practice. Stay safe, stay healthy, and we'll see you in the next one. All the best. Take care.